If it's tough for you to get out of bed and take the first steps, or if you have pain on the bottom of your foot all day, you're going to want to stay tuned to this video to find out why and what to do for it. I'm Dr. Gregg Gerstin with Align Wellness Center. I'm a chiropractor who helps people focus on developing optimal health and wellness. Today we're focusing on one of the things that we've helped many patients with in the past, and that's called plantar fasciitis. Now, what the heck is that? So the plantar fascia is actually a part of your foot. So when we wind up looking at this picture, we've got your toes over here and then your leg coming straight up like this. The plantar fascia is some tissue that goes across the bottom of your foot and helps to create the arch. It helps to wind up lifting up your feet so that your feet can absorb all the shock that your body puts through it as you take every step. Now, if you've had problems in the past, traumas and accidents, and you don't even have to remember them, they can wind up changing the structures and how the bones in your feet wind up working. It winds up altering or lengthening the fascia on the bottom of your foot. Now, that fascia is designed to have a certain length, and it's designed to help propel you forward when you take steps. But if the mechanics are off on your foot, it can stress and strain the bottom of your foot so that it overworks and you develop a tendinitis of this fascia or an inflammation of this fascia. Most treatment protocols wind up calling for resting this and or just treating the inflammation. Very few find the cause of the problem and wind up taking care of it. As we go through our series this month, we're going to talk about things you can do at home to help with managing the inflammation. And then we're going to talk about things to do to wind up solving the problem that caused it. Whether it's a change in the structures of your bones in your foot, or in how all of the weight is coming down onto your foot, changing how the foot is able to absorb the pressure. Either one of these and both of these can wind up causing these problems. And if you don't have someone who's skilled in not only looking at the foot, but also how the weight gets distributed to it and how the information gets down to it, you'll wind up missing the bucket. And for many people, this is something that reoccurs throughout their life. So they might have it once, but then a couple of years later it shows back up. And people say it's a separate episode. It really isn't. It's just that you've managed the episode and not taking care of the cause of the problem. The problem when you wind up doing that is that episode over episode, they wind up getting worse. They wind up becoming more difficult to wind up getting rid of the pain, and they wind up becoming more permanent the longer you leave it. Finding the cause is the key, correcting the cause is the key, and we're going to look to help you with that over the next couple of videos, so be sure to check them out. Once again, I'm Dr. Gregg Gerstin, and thank you for letting me be a part of your health.